Good morning. I'm Kevin Kincaid. I'm the CEO of Knoxville Hospital and Clinics, and welcome to a beautiful January morning in Knoxville, Iowa. So, we have a brand new emergency department that we've completely redesigned, but it happens to be in the same place of our old emergency room, and so it's impossible to have an open house to the public. And so, what we thought we'd do is a virtual tour and be able to show folks around and be able to check out our new ER. And come on in and let me show you around. So this is our new entrance, and so it's actually the site of the old entrance, but it's completely reconfigured. And as you come on in, this is where you would see the reception area. And this particular area here has a lot of new features that really incorporate an awful lot of safety. So this is all safety glass. And our staff that work behind here can also shut down the facility at any given time as it relates to this departmental area if we were to have any kind of security situation going on. And then this is our waiting room. This is our new waiting room. We have an area in the back that we can do puzzles and people can plug in their electronic devices. We have a bathroom for the public that's just for them. TV to try to burn some time once people have to wait. And so this is one of the nicest additions that we were able to incorporate into this project. And this is our consultation room. And you'll notice that it's very close to the waiting area. And this is something that we've never had before because occasionally emergency room providers need to talk to families immediately. You need to have a private conversation close by where people can participate as needed. And so we've never had a consultation room. So we built this specifically for this to be able to have those tough conversations in privacy that's close to where the family would be. And this is how we come back into the emergency room with all the new securities that we have. This is an example of one of our private treatment spaces. This was a big part of the project, is that we wanted to make sure that we had exam rooms that were plenty big enough for any condition that a person was facing and have plenty of room for all of our staff, yet be able to have a private experience. And here we have our new trauma bays. And we redid our trauma bays in 2015. And so those served us quite well. But since 2015, we've learned a lot of things and over the traumas that we've had. And so the staff kind of collected up a list of things they would like to see improved upon and kind of some more modern designs. And so while we were in here doing all the work in this emergency room, we went ahead and redid our trauma bays. And so this is what you see. So this is the latest and greatest in all the technologies. We have all the supplies that we need right here and plenty of room for all the people that need to come in and out in a trauma. You'd be surprised at the number of specialties that will show up at a moment's notice to take care of anybody in any kind of traumatic situation. Another key function that we want to make drastic improvements on in this project was to improve our workspaces for staff. So we more than quadrupled the amount of square footage that we had for our staff from the original 1980 design. And so this is what you can see. So we have all the available space for all of our rockstar docs, one of them sitting right here. And all of our staff can be back there doing their work with plenty of room to spread out, be able to have private conversations. Back in the back, they have the break room and their own bathrooms. And so it's a drastic improvement of everything that we've done since the 1980 original design. One of our other improvements that we were really concentrating on was making sure that we had our facility prepared to deal with people that were facing mental health conditions. And so what we really wanted to kind of think about is that could be all-inclusive for their entire stay. So many of our mental health patients might stay with us for several days. So in the old design, all we had was a bathroom. And so this is a new bathroom, but it's very specific for a mental health patient. And so you'll see that we have the ability for these folks to be able to take a shower safely This whole thing is designed, you'll see this is a very unusual doorknob. These are all the latest in technologies for mental health patients. There's nothing that can be tied to that. And so this is a great addition and one of the stops or one of the improvements that we made for taking care of our mental health patients. So here's one of our additional private treatment spaces that also has some specific designs that take into consideration the needs of our mental health patients. So if you were to come into this, it does look at first glance like a regular exam room, but if you come on in, I can show you a few things that are pretty unique about this. So when somebody's in a mental health crisis, we've had a lot of things that we have to work with to try to keep them safe. We also have violent outbursts. That's not heard of either, or unheard of either. So this room, everything that you see in here, from the sprinkler heads to the lights to the TVs that are around the corner, cannot be broken. You can throw anything you want at this stuff, you cannot break it. It's all safety material. So it keeps everything kind of safe so nothing gets broke and can be used against us. And then also another added safety feature is we can lock everything up in here. So like even for the sinks, we have the ability to lock them behind the doors because there are things we don't want people to get at in certain conditions, but otherwise it could just operate as a regular sink. This is an emergency room, and so sometimes people need things like oxygen and suction and all the monitors that we provide for people. So we wanted to definitely include this into the space that we built, but there are times when we don't want people to have access to that. So here's one of the special things that we did, was the ability just to lock this down with basically a steel door. Now, essentially, if I lock these cabinet doors, I have this door down. We have a lock space that's very safe for people. So we have this set up to lock down, and we can also function it with the general public for any regular medical condition, whether that's you need sutures or you're having a headache or back problems or you broke your arm. We can use it for this, but it's also specifically designed to handle our mental health patients that we occasionally see. Okay, we want to show you some of our staff workspaces. This was a big part of the project where we wanted to make some major improvements for where these people do their work. So you can see in this space, we got Amanda and Christina are here today on shift. And so you can see this is their current workspaces, and so they can adjust them ever how they want to. So let's come on in here. Today is Angie's day to be able to work in here. So this is the front reception area. We got room so there can be other people in here helping out. And I had mentioned earlier about a lot of the safety features that we have. And this is what I meant by that. We have the ability to lock down the emergency room should we have that situation. So all we got to do is hit that button and we can lock ourselves down to keep ourselves safe and the public safe. So a lot of great improvements in this area, and it's been a big part of the project. Well, thank you for joining me on this virtual tour. We really wish we could have had some sort of public open house, but I'm sure you can understand we have a fully functioning ER, and today was a great day to take you on a tour and show you some of the great things that we've been able to get done. And a lot of that couldn't have happened without all the public support that we had, mostly through our foundation. And I want to thank our staff and all the people that were able to make this happen. So really appreciate it. Have a great rest of your week.